everybody. I'm Julie diLiberti. We're here with another COVID global chat. I am a professor of humanities at College of DuPage and the Global Education Liaison. And today I'm with Shannon Brown and Karen Ferreira-Meyers. So Shannon is an associate professor at the College of DuPage in teacher preparation. And Karen is an associate professor of linguistics at the University of Eswatini. What? Eswatini, you ask? We're going to show you the map in just a minute. Both, I'm going to let Karen and Shannon just mention briefly what their credentials are. Why? So we thought we would talk about education on two different continents and how COVID has affected education. And so I'd like Shannon and Karen, Professor Ferreira-Meyers and Professor Brown, to give us a little bit of information on their backgrounds in education.
Good afternoon, or good evening, or good morning, everyone. Indeed, associate professor in French, basically, but I coordinate programs in linguistics and modern languages at the University of Eswatini, which is in southern Africa. So my focus is and has always been on high school and higher education, but of course, I mean, through colleagues, we also know what is going on in other levels of the educational sector.
Sure. And Professor Brown, before we have you go, let me show the map of where Professor Ferreira. Karen, can you say your name again?
Okay, my name is Karen Ferreira-Meyers. But please call me Karen, it's much easier.
I'm sorry. Okay. I do want to show everybody where Karen's from. If you look here, can you all see the map? We've got Eswatini here. And Karen, you can correct my pronunciation if you would like as well. So you can see that we've got Namibia here and Zimbabwe and Lesotho, and then we've got Durban. So it's sort of landlocked in South Africa, right?
In Southern Africa.
Southern Africa, because South Africa is a country. You're absolutely right. Thank you. I also want to take a minute and show a picture of Karen's university. So you can see up here, if you can all see that, we've got the students and we've got some pictures of buildings going through, but you can see that it's a university like ours, and I just want to dispel maybe any myths that might be somewhat different. We'll talk about some differences perhaps throughout the conversation, but you can see that there's even distance education, and I think that's one of the big things that we'll be talking about today anyway. Okay. The United Nations, I want to start out by offering, I'm sorry, I want Professor Brown to introduce herself a little bit and tell us her background.
So I am an associate professor of education in the teacher prep program at the College of DuPage. I've been there 6 years. My primary focus is on cultural diversity, as well as I teach intro to ed and school procedures. Prior to that, I was a principal and an assistant principal. I taught junior high science and a plethora of other positions in the K-12 sector over the past 16 years.
Okay, so we've got some good background. And I, by the way, am wearing my Illinois Community College t-shirt that says "A Million Reasons Why," because Shannon and I both teach at community college, and in Illinois there are 48 community colleges, and about 1 million students a year use that. So I just want to put a plug in for that. So we have UNESCO that says 1.4 billion learners were affected worldwide by COVID, and this was their March 25th certificate. And their statistic also said 70% of students worldwide were affected. And I'm like, well, why not 100? But I didn't find any articles that explain that 30%, right? But UNESCO said that the reason, obviously, this was so affected is that governments, almost all governments, have temporarily closed educational institutions. And I know the three of us know, and that many people watching this know, that educational institutions did not shut down, educational buildings shut down, because we know that education persisted and went on and transformed. And so I guess I want to talk to you a little bit about that. And I have a little quiz, but I have, so this is going to be a little bit longer introduction than usual. I want to set up some things. DuPage County has about 1 million residents. 922,000, and Eswatini has about 1.1 million residents, right? 88.4% of people in Eswatini are literate, and what that means is, according to the CIA fact book, that people above 15 years of age can read. Karen, do you want to talk about that literacy rate? Do you want me to keep? I I should let you talk about your own country. Karen is having some connectivity issues, so I'm going to keep blabbing on. And then you can correct me if based on what you can hear. Population above 15 years of age can read short sentences about their life, and about 40% of people in Eswatini live under $1, or under what we would call $1.90 a day. And if you raise that percentage, if you say, well, what about people living on $3 a day, $3.20 a day, 60% of the population in Eswatini lives under Americans' $3.20 a day. DuPage County we've got 3 cities in DuPage County, Wheaton, Naperville, and Hinsdale, which make us the 25th wealthiest county in the United States. And in terms of literacy or education, 48% of people living in DuPage County have a bachelor's degree or above. So those are some comparisons to make between these two. And having those comparisons in mind, I'm going to run down a list of questions. And Karen and Shannon, I just want you to shout out, yes, you had the issue, or no, you didn't have the issue, as COVID took over. So did you or your students have issues with access to technology?
Yes.
Yes.
Access to internet?
Yes.
Yes.
Access to telephones?
Yes.
Yes.
Access to computers?
Yes.
Connectivity issues?
Yes.
You're Shannon's smiling because they're both having them today, right?
Yes.
Did either of you have to make content changes in your delivery?
Yes.
Yes.
Did you have to change your delivery mode?
Yes.
Yes.
Were relationships, were there barriers that came, not boundaries, but barriers that developed between students and faculty during COVID?
Yes.
We'll come back to Karen in just a second. And then were there disrupted relationships?
Yes.
So we'll get Karen's answers in just a second.
Yes.
Karen, disrupted relationships, did you,
Yes.
we were asked,
Yes.
okay.
Definitely.
Did you learn about any students who were in unsafe conditions?
Yes.
Yes. Higher numbers than usual of domestic violence.
Okay, which is on the rise, yes, everywhere.
Yeah.
Were either of you dealing with a marginalized student group? So either
Yes.
socioeconomically or legal standing wise? Okay.
Yes, both.
I'm sorry, say it again, Karen?
Both.
Both?
Said
Oh, Shannon, sorry. Okay. Did anyone have limited access to technology because of finances,
yes.
because
Yes.
of family structure?
Yes.
Okay. Are there other issues? Did anyone have a loss of health insurance?
That I'm not aware of.
We hardly have any health insurance, so definitely
Everybody's dealing with,
people have
okay.
issues, definitely.
Is insurance the same, a little off topic, do you need insurance to go to a hospital like you do here, Karen?
No, if you want to go to a private hospital, it will be easier, but you can always put a cash deposit. But if you want to go to a public hospital, you can go, it's very affordable.
Okay.
Yeah.
Part of the things I was, Shannon, did you want to answer?
So I don't know particularly about healthcare, but I did have a number of students who lost their jobs or their family members lost employment. And if that was connected to healthcare, then yes. But specifically related to that, I'm not aware.
So I think that's interesting because that's a question I guess I want to ask too before we get to solutions or going back to school. Karen, we had a lot of people here having to step up for their parents who had lost their jobs, so they couldn't necessarily be at school any longer because even though they'd signed up for classes, all of a sudden the financial realities had changed. I'm wondering if you had to deal with any of that as well. And Shannon, what kinds of other issues do you think that you want to talk about or that you had in your class?
Families getting sick. I had 2 students report to me that someone in their family tested positive for COVID and they were quarantined. So they were responsible for taking care of younger family members and siblings. Many of my students have children of their own. So it was very difficult for my students to balance a work-school life.
Karen, what kinds of things happened, or for you in Eswatini?
I mean, with us, it's very normal for our students to already have to help out at home and have a job. Some of them lost their job, but we have no insurance whatsoever for people who lose their job. So if you lose your job, you don't have an income, full stop. Government is trying to assist, there's food distributions and things like that, but it started very late. I mean, we were already at least a month into lockdown when it started. So people have been really struggling at home.
Let me ask you, Karen, because you guys, I feel like you went into lockdown a lot later than we did. But you guys your numbers don't seem worse than ours, or am I misreading that? Are you guys doing okay?
We went into lockdown it's now 2 months ago. We called it a partial lockdown, but it was actually a complete lockdown. Our numbers are very low. We have about 280 cases, and we've luckily had only 2 deaths until now. It's a bit, again, with numbers here, we don't really trust the numbers that we're getting. So we're hearing through the grapevine of people who are dying. We're not sure what exactly is going on. So those are official numbers only.
Okay. Well, let me turn it over to you two to tell us a little about it. Maybe you guys can ask each other questions, or I mean, I certainly have a billion of them. So I guess I just want to get a sense of, if I said to you, how did COVID affect education and how is it going to affect education? What do you want us to know about your different experiences and the similarity and the differences between your experiences? Professor Karen, do you want to start? We're afraid we'll lose you first, so we're going to let you start.
All right. Okay, so when the lockdown started, all schools were the buildings were closed. Everybody was asked to stay at home. And in most of the schools, that also meant that nothing was happening. This took quite a long time, I think at least 3 weeks, if not a full month, where in certain schools, in most schools, nothing was happening at all. The ministry then put its act kind of together and started both lessons on TV and lessons on the radio. This, of course, doesn't reach everyone at all. So that's a major issue.
So when you say nothing was happening, Karen, do you mean teachers weren't, because there was no plan, or because there's no internet, so you would have to deliver by hand, or how?
Both. There was no plan whatsoever. And, people don't have access to the internet, basically. So this online mode was impossible. So the closest solution that the ministry thought was something that was workable was TV, afternoon classes for the last year of primary school and the last year of high school. And a week
on
or
TV?
2 after that, radio.
Okay. Wow,
Yeah.
That's interesting to use a national broadcasting system. That's very interesting.
Yes.
So yes. I want to, before, my sister...
Unfortunately, these lessons were given, we have 2 official languages here, Siswati and English, but the schooling system is mainly in English. So that also means that exams, which haven't been cancelled yet or haven't been moved yet, exams are written in English. But the lessons on TV were given in Siswati. So that also brought a lot of confusion.
Because you're going to be tested in English, but you're learning in Siswati. Okay. I'm going to go back to this, and the UNESCO tells us that only 60% of the global population, only 60% is online. So yeah, you guys directly face that. But my sister lives in Elgin, and she teaches 5th grade, and she said one of the things that they had to sometimes do was make packets for the students, and the students could drive by and pick those up. And Shannon, you're nodding because you probably have some experience with that. So do you want to tell us a little bit about how and then I'm going to sort of back out of here and let you two chat.
So I would say that it took us about a week, both at College of DuPage and K-12, most K-12 institutions. We're given about a week to transform everything from face-to-face to some type of a remote learning system. There's a huge technology divide in low-income areas. Bus drivers would drop packets off to some low-income areas at the bus stops where students could pick up their packets. In other cases, they were able to pick them up at school if transportation was available to them. But our students had to figure out how to learn remotely. Especially my experience, I have a third grader and two sixth graders, and they're not used to sitting in front of a computer for 5+ hours a day trying to get their work done. Nothing was really given in a synchronous session. Everything was either pre-recorded or there was just assignments that they were to do almost on their own. So they were learning by themselves or through YouTube or Khan Academy or different modes like that. So I would say overall in Illinois, we did a really great job of getting everything together, but the resources are still just not there for our students across the U.S., not just Illinois.
No, Karen, in the U.S., some people were taking the initiative and putting Wi-Fi in buses so that we could create hotspots. And so buses would drive into certain neighborhoods, and then people in that neighborhood would be able to access that for a certain amount of time during the day. And then, so that was one initiative, right?
That sounds like a really wonderful initiative. I mean, it's not very workable here because we don't have, fixed bus lines and fixed bus stops. And in the beginning of our lockdown, even transport was not possible. So basically, if you don't have your own car, you weren't going to go anywhere unless you were walking. So that would have been impossible. Some of the private schools, we do have a few private schools, also worked with the packages and worked with online classes, but that is a very, very small amount of learners who were reached in that way.
There's quite a bit of private and parochial schools, at least in Illinois, that are completely closed now due to lack of funding. So they're being hit hard because of the pandemic.
I wanted to know also from Shannon, how was the system able to support the teachers? Because I mean, it's not easy to suddenly start remote teaching. I mean, we're not really prepared for that. We're not really equipped for that.
I wouldn't say nationwide or even Illinois-wide. I wouldn't say that districts were able to support teachers the way they needed to be supported. If you were to ask me prior to the pandemic when K-12 schools would be able to go fully online, I would have probably said 100 years from now. And we had to do it within a week. I know some of the low-income areas, some of the teachers even had technology issues and technology capability issues. Districts were trying to find money to support teachers in getting them laptops or iPads, tablets, something like that, as well as there are teachers in Illinois in rural areas that their access to internet is just not the same as suburban areas. And
I do want to say too, Karen, you toured our campus, but we had a food pantry that stayed open on the campus, right? We had students who didn't have technology, and through some grant, a prior grant, that there were 100 Chromebooks that they were able to offer to students, but that's not everybody. And my sister, who also teaches 5th grade, again, she said that they just spent the schools were they weren't meeting with students for 2 weeks. They gave the students some things to do, but for 2 solid weeks, she was taking training on Zoom and a whole bunch of other technologies. But even then, as Shannon said, and as you've said, not everybody had access to the technology. Plus, we find that sometimes whole families of many children and parents are sharing one computer, and people have to work and people have to do classwork. So how is that all going to work? Yeah, go ahead.
And what about the parents? How did parents react? Because I mean, it's one thing, to normally drop your your child off at the bus stop or at school. It's another one to have to be at home with all the stress you have to be working. And then on top of that, you need to help your children, get through their school day, their remote school day. How did parents react?
So I can speak personally about this issue because I have 4 children of my own, and my fiance has 2. So I have 6 children living in my household, as well as having to teach online. So there was a big schedule change for me where I typically work during the day. I was working with my kids at home to help them with the material that they needed help on, and kind of putting everything that I needed to do off until later on in the afternoon, early evening, sometimes after they went to bed, to check emails and respond and grade. So it absolutely has been the most stressful last 3 months of my life. And I know that I can speak for a lot of parents because many of my friends are also parents, and they feel the same way. Many of them were not trained in education as I was, so they don't know how to help their students the way that they need to be helped. I know there are many parents even thinking in the fall, what are we going to do when we're required to go back to work, but maybe our children are not in school? What are we going to do for childcare at that point?
Yes,
And I think that's one of the right. And I think that for so long, our society has confused education with childcare. Did you have the same issue, Karen, in Eswatini?
I didn't get the beginning of the question.
Did you have the same issue with
childcare?
parents? How did parents react in Eswatini?
I think, okay, the parents who have a bit of an educational background, or who've been to school themselves long enough, they try to assist, but that's very limited. All the other children are just left to their own devices, so basically nothing is being done to help them. So I actually wanted to ask about that. Has the school calendar been changed? Has there been any adjustment? Because our school calendar is hanging. Nobody knows, what will happen with the rest of the year. And this year, we had barely started in primary and high school. They normally start end of January, beginning of February. So this year, we really don't know what's going to happen. And
I read a statistic that said students that go, they extrapolated, and if you're missing 12 weeks of education, there's a 6% loss of acquired skills. And Shannon, you might be able to speak to that better. But what do you know about the effects of missing education and missing school, or no?
Well, there's a lot of research that shows just that happens over summer. When students are out of school for about 12 weeks, they're academically farther behind than some students that are continuing to practice during the summer. As far as our school year goes, we've concluded our school year for the semester at COD, as well as K-12 education is concluded. So we are on essentially summer break, but it's still uncertain as to how the fall is going to roll out, whether it's going to be remote or a hybrid model. For K-12, for us at the College of DuPage, we're pretty much all online with the exception of some lab classes that require some type of face-to-face interaction.
And what about teacher training? Because we had come at the university, we have a slightly different academic calendar. So we start in August. We were in the second semester. When COVID-19 happened, our learner teachers were supposed to go and do their internships, go to schools and teach. This is now impossible, and it might not be possible for another couple of months. So we kind of don't know what we're supposed to do with them, how to solve this issue. Have you had a similar thing happening?
So in Illinois, any of the teachers would have started student teaching in January, and the majority of them just followed the teacher going remotely. There is what's called the EdTPA, which is a portfolio project that the students are required to complete to get licensure in Illinois. That requirement was waived this semester. If they weren't able to complete that project, they were still able to move on to get licensure. As for any teacher that needed to, current practicing teacher that needed to renew their license as of June 30th, they were given a year extension to complete the professional development requirement to renew their license. So there are adjustments that are being made to licensure, but I believe for the most part, all teachers were able to complete their student teaching training remotely, and which is probably a good thing if they're going to start in the fall remotely, that they have some experience remotely.
But we have,
Yeah,
again, healthcare professional students in healthcare professions that haven't been able to do their clinicals. We have architects who can't, we've had auto mechanics. And so it's yeah. And it's interesting you say in a couple of months you're waiting for, Karen. We're all kind of worried about the next couple of months because that's when the second wave is supposed to hit and a second spike. And so we're saying, well, do we want to go back in the fall? Do we believe the numbers? Do we believe, we've got it under control? It seems now we've moved to a phase where we can have 10 gatherings of 10 people. But if we go back in the fall, we don't want to have to yank the students out again. So the question is, do we go all online, which we know poses some problems for students? At least this time they'll know they're signing up for online classes. Nobody knew, right? Faculty or teachers, that we were going to do remote learning last time. So there's we're still up in the air. I mean, the timeline stays the same. The question is, how do we handle the timeline? How are we going to teach? Will people be in the physical classrooms? And they're realizing too that you can say you can hold classes with just 10 people in a room and keep social distancing, but we know, well, you guys were going to talk about some of this yourself when we go back. 10 people in a room, they still have to move around. Is it really feasible? Global Education, UNESCO put together a Global Education Council, and they tried to come together up with some solutions, but we all know this exposed the gaps. This exposed the technology gaps, the access gaps, the healthcare gaps in our system. One of the reasons I want to start out with that comparison of Eswatini and DuPage County is because we're doing the same issues. A lot of people were comparing it for us, Karen, to Hurricane Katrina. When Hurricane Katrina happened in Louisiana, and they had to they were not prepared to go fully remote, but education still happened. So I think that's sort of a model for us. But the Global Education Initiative from UNESCO wants to bring in together IT partners, media partners. They want to fill in teaching gaps with low tech and high tech. Even Sesame Street is involved in this initiative at some levels. So they are looking at all levels of education. But when we first started this conversation, and I've got several solutions that people have suggested, but I know you guys both wanted to talk about what it will look like when we go back. Before we started recording, you guys were talking about some things that might or might not happen when you go back to your respective schools. So I'm just going to let one of you start that conversation, and then also, do you have solutions, and what gaps do you see, and how do you think students feel about going back? I think mentally we all want to go back, but I'll let you guys take it away.
I think some of the biggest fears are budget cuts. We're looking at 10 to 30% in budget cuts across the nation for schools, where schools got, there was $2 trillion that was available from the CARES Act. And on average, that only gave about a little less than $300 per student nationwide, which isn't much money, especially going remotely. When we're talking about going face-to-face, we're talking about increased hand sanitizer and PPEs, hand washing stations, plastic divides, which could cost more than $50 million per state to be able to supply these extra needs, but already at a decreased budget because budgets are being cut. When we talk about going back, are we talking about doing a split schedule where some students come in the morning, some come in the afternoon, or some come on Monday, Tuesday, while others come on Wednesday, Thursday? And if we're doing a split schedule, that means we need more staff, not less staff. And how do we hire more staff when when the funds are being cut at such a high rate? And then access to technology. Before we can even think about going back remotely, if that's a thing, remotely in the fall, or even in a hybrid model where some is being taught face-to-face and other parts of the curriculum is being taught remotely, we need to make sure that all students have accessibility, have a device in their hand and have access to internet, and however that has to happen, that really needs to be considered before we can decide to do what we've been doing since what was it, March 13th.
Right.
So there's
Karen, what does that look like for you guys, or what are your thoughts on going back?
Yeah, I mean, all the issues raised by Shannon are valid in our situation as well. I think ours, we have to add other issues. If people stay without an income for a couple of months, some people will be almost dying of hunger.
Right.
Even if we get them back to some schools at some point, most schools, well, no, not most schools, but all the schools in the rural areas, I would say about 60 or 70% of those schools don't have proper access to water and electricity. So, perhaps the government can provide hand sanitizer, but the rule for now has been that people should wash their hands with running water and soap. In many of the schools, there is no water.
Right.
So we will have a whole set of other complicating issues that need to be dealt with. Our government is stretched beyond. We have no idea what kind of cuts will come. Yeah, we really don't have any information about that, but we know there will be major cuts. Especially since the health sector, they have had to hire additional staff. So government will be broke for sure. So that really complicates matters even more, I think.
So I'm sorry. Go ahead, Karen.
As of Monday, Shannon, as of Monday, many of our childcare facilities are reopening that are qualified under the Illinois Department of Public Health, but are requiring anyone who is 2 years or over 2 years, 2 years or older, to wear face masks or face coverings. I don't know about anyone else, but I have a 3-year-old, and I might be able to get him to wear it for 10 seconds, and his is a really cool Avengers one. So I don't understand. I don't know how facilities are going to police this. And when we return to K-12 and kindergartners are not wanting to wear masks and they're wanting to hug their friends and, put things in their mouths, how is the spread of infection going to decrease even if the class number is decreased when these habits that are formed at home roll over into the classroom?
Yes. And on top of that, also the emotional, emotional and social habits. I mean, these kids have been deprived of their friends for months now. So as soon as they're going to see each other, they'll want to hug and sit next to each other and hold each other's hands. So it's just going to be horrible.
Right. And it's funny because I think in Sweden, it's not, but in Sweden, they had the experiment of herd immunity. They didn't shut down the schools. They protected the elderly and but now, and so they were doing fine for a while because they thought they were going to develop herd immunity, but Sweden's numbers have now spiked. So putting 3-year-olds and 10-year-olds together, even, I'm an adult, I want to go hug people, trust me. But yes, I wear the mask longer than a 3-year-old. But those are some real concerns. I think one of the things that UNESCO points out and that this discussion points out is that these issues are across the globe. And it's interesting because when you read articles and people suggest solutions, the articles I read all said at every level of government, education has to be a priority. But what considers education is you have to have a health itinerary. You have to have, all these things are interconnected. You have to have public and private partnerships. The people from comparing it to what Katrina said, you have to have campus-to-campus partnerships. So maybe one campus can't do everything, but you might as well be borrowing from other campuses that already might have other resources in place. But Karen, I don't know if that would apply to you. Are there I think there are 3 branches of your university in your whole country. Is that correct? Or
Yes, we have a few universities. At some point I suggested to our management that because the primary schools will go back and the high schools will go back long before we go back, that our venues should be used to house some of the kids so that at least the teaching, they have more space to teach the younger children. That doesn't solve it for us. I don't know what we will do, honestly. I've got no idea. I mean, it's just impossible to even fathom what will happen.
so is education, maybe for both of you, is education going to fall by the wayside? I mean, obviously UNESCO says it's got to be a top government priority because it's so interconnected to everything else we do. We know that this generation, for education forum, Dell Technology says 85% of jobs that our students today are going to apply for haven't yet been invented. By 2030, and so we can't really stop education, but do you feel it's going to fall by the wayside, or do you feel in your respective countries?
I don't feel that it's going to fall by the wayside. I feel if anything that remote learning to some degree will happen in the fall. However, as much as education is a top priority, health and safety is more of a top priority. And that has to be the main concern before we put children in a classroom together, to make sure that everyone is safe, and who they're returning to are also going to be safe. Because we've seen that the deaths for younger people, for grade school people, are not very high, but those kids are coming home to people who are not 3 and 5 years old, and many in multi-generational households where they are living with people over 65 who are at a higher risk of developing severe concerns from COVID, if not death. So there's that safety and health concern much greater than the educational concern right now. That needs to be our top priority.
I fully agree with that. The health should be our priority, and because the health issues are compounded also by, okay, we know that it's underlying diseases. I mean, could be all kinds of diseases, cancers or obesity or whatever, lifestyle issues. I mean, with us at the moment, HIV and tuberculosis are still major concerns, and some of the drugs, the medicine that is needed will perhaps not be able, will not be bought because all the focus is now on COVID-19. So, and even the health facilities, the resources are now being transformed to house people with coronavirus. And it means that other diseases are not being cared for as they should. So that's also going to have a major impact.
This is astounding. If you were a student from either of our countries watching this, what should we know? What should we know about each of your countries with regard to COVID, education? And you've talked about a lot, but before we leave, sort of what parting information do you all both want to offer, or parting thoughts? What did I not ask that you wanted to talk about?
I think our students really need to focus on their mental health. As far as College of DuPage goes, we have resources for students to reach out to counselors, to focus on mental health. And I think that needs to be a priority even for K-12 students. As Karen said, our students have not been able to see their friends or their family, give people hugs. So that really needs to be a focus right now. So I think that teachers need to understand that, faculty needs to understand that that social component is just not, and hasn't been for a while, it's not there. So there needs to be more empathy towards that across the board.
I agree with you on the mental health issues. I mean, that's also something that has been pushed kind of aside, but it's going to have a major impact on all of us, on our learners, on their families, just coping. especially because we don't know how long this will go on for. And so this living with not knowing is extremely stressful. I also think that for many African countries, the issue of hunger will have a major long-term effect. We're going into winter now, so on the agricultural side, there will be not much forthcoming. Our borders have been closed, so we depend heavily, in Eswatini, we depend heavily on imports from South Africa. They're not coming in.
Oh, I didn't realize that.
Yeah, it's going to be really tough for the next couple of months, if not years, because these consequences will last for a long time. I'm also, there was something else going through my mind. Oh, I haven't talked about this, but in South Africa, while during the lockdown, I mean, they are releasing the lockdown slowly, but during the lockdown, more than 1,000 schools were vandalized, burnt down, because people didn't understand what was going on. So also there, that will have, a major impact. So it's a bit doom and gloom these days. We're trying to remain optimistic, and we're all doing our little bits, but it's not looking very well.
And well, I guess that's a different discussion in terms of, the government and things that can be done. I have there's a thing that goes around Facebook where it shows that there were librarians that used to take books out on horseback to various people, and I wonder if education will transform that way, if teachers are going to be riding on horses to various neighborhoods to educate. But I agree. It goes. It's a whole discussion about Jane Addams and how she felt that if you weren't treating people's health needs and social needs, you couldn't really, education was, as you both said, education couldn't fall. I mean, all these things are so interconnected that education couldn't be the only priority. Well, thank you both. If you want to say anything before we take off, if not, I guess we'll stop here.